Complete denture occlusion. What are the objectives of balanced occlusion? By giving a bilateral balanced occlusion, it improves the stability of the denture, it reduces the resorption of the residual ridge and soreness, it improves oral comfort and well-being of the patient. As you can see in this picture, even in the working side is nothing but the side to which the mandible moves. If the mandible moves to the right hand side, then the right hand side is called as the working side, whereas the left hand side will be called as the balancing side or the lateral side. And then so if you see there in bilateral balanced occlusion, there is bilateral contact of teeth on the working, on the balancing as well as on the protrusive sides. Coming on to the general considerations for balanced occlusion, wider and larger the ridge, the teeth should be closer to the ridge and greater will be the lever balance. Wider the ridge and narrower the teeth buccolingually, greater will be the balance. The more lingual the teeth are placed in relation to the ridge crest, greater will be the balance. The more centered are the force of occlusion anterior-posteriorly, greater will be the stability of the denture. Coming on to the types of balanced occlusion, we have unilateral, bilateral and protrusive. Unilateral lever balance is present when there is balance of the base on its supporting structures, when foot bolus is interposed between the upper and the lower teeth, and when the space exists between the teeth on the opposite side. The following points must be encouraged to consider a lever balance. The teeth should be placed in such a way that the forces are directed towards the functioning side over the ridge or slightly lingual to it. Having the base as broad as possible dissipates the forces, and placing the teeth as close to the ridge as the other factors will permit is important. Using a narrow buccolingual with occlusal foot table is remained to be practical. Unilateral occlusal balance, it is present when occlusal surface of the teeth on one side articulates simultaneously as a group with smooth uninterrupted glide. Bilateral occlusal balance is present when there is equilibration in both sides of the denture due to simultaneous contact of teeth in centric and eccentric. It requires at least a minimum of 3 contact points. The more the contacts, the more will be the balance. Prime gave the concept of enter bolus exit balance, which implies that the introduction of food on one side will prevent the contact of teeth on the other side, and hence he said enter bolus exit balance. The following are the factors which influence the bilateral balanced occlusion. The condylar guidance, that is the inclination of the condylar path, is number 1. Number 2 is incisal guidance. Number 3 is orientation of the plane of occlusion. Number 4 is cuspal angulation, and the last one is compensatory curves. Condylar guidance is nothing but the mandibular guidance generated by the condyle and the articular disc traversing the contour of the glenoid fossa. This condylar guidance is due to the path followed by the condyle in the temporomandibular joint, and it is obtained by registering a protrusive intraocclusal record. Now this is a factor which is not under the control of the operator. The significance of this is increase in condylar guidance increases jaw separation during protrusion, and in patients with steep condylar guidance, the incisal guidance should be decreased to reduce the amount of jaw separation during protrusion. As this factor cannot be modified, all other factors should be compensated for getting balance in the denture. Incisal guidance is the influence of the contacting surfaces of the mandibular and maxillary anterior teeth, the influence of the contacting surfaces of the guide plane and guide planes on the articulator movements. Anatomically, the angle formed by the intersection of the plane of occlusion and a line with the sagittal plane determined by the incisal edges of upper and lower central incisors in maximum intercuspal position. The angle of incisal guidance is largely under the influence of the dentist. The dentist decides on the amount of horizontal overlap and vertical overlap. Greater the horizontal overlap, lesser is the angle of inclination, and lesser the vertical overlap, lesser is the angle of inclination. The third criteria is the plane of occlusion or occlusal plane, which is usually determined with the help of face bows in the orientation jaw relation. It's very important that the plane is detected correctly based on the opening axis of the hinge maxilla in relationship to the cranium, and this relationship has to be transferred onto the articulator. Now then we have the occlusal plane. This is a picture which shows you the occlusal plane, how it is made parallel to the denture bearing areas or the foundation areas, and usually it stops posteriorly at the level of 2/3 of the retromolar pad. Now coming on to the next one is the compensatory curves. We have natural curves like curve of Spee, which is anterior posterior, and mediolateral monsoon curve or Wilson's curve. Now these curves are not present once the teeth are lost. So this has to be compensated in complete denture in order to ensure stability of the prosthesis. When we do not try to compensate these curves or curve of Spee or curve of Wilson or curve of monsoon, what happens is the denture can get displaced very easily. So it is very important that we follow the teeth arrangement principles so that we try to impart or incorporate these compensatory curves during your obtaining complete denture occlusion. Now coming on to the Hanau's law of articulation, there are 9 factors which determine the articulation according to Hanau. He said horizontal condylar guidance, compensatory curves, protrusive incisal guidance, plane of orientation, buccolingual inclination of tooth axis, sagittal condylar pathway, sagittal incisal guidance, tooth alignment, our relative cusp heights are very critical factors for determining the bilateral balanced occlusion. He said these factors in toto, that is these 5 factors are called as Hanau's quint, which are important. Thielman gave a formula for balanced occlusion. He divided it in the form of numerator and denominator. In the numerator was the condylar inclination and incisal inclination was directly proportional to balanced occlusion, and inversely proportional were the cuspal angulation or the height, the plane of occlusion, and the prominence of compensatory curves. Now, with tilting of the second molars, Porter felt that there can be increase in stability of the denture, because what happens is usually Christensen's phenomenon does exist, because when the mandible is protruded, there occurs disocclusion and a separation between the upper and lower teeth, and a space gets developed in the rear portion. Now, Porter felt that by tilting the mandibular second molar, this space can be obliterated.